Can I have acupuncture if I am on blood thinners? If you're considering acupuncture but are on blood thinners, you're right to wonder if it's safe for you. Let's break down the details to help you make an informed decision. First, it's important to understand that blood thinners are medications that prevent blood clots from forming or growing. When you're on these medications, there are some special considerations you need to keep in mind when it comes to acupuncture. Acupuncture involves the insertion of very fine needles into specific points on your body. While this is generally a safe procedure, there are some risks to consider if you're taking blood thinners. The main concern is the increased risk of bleeding or bruising where the needles are inserted. This is because blood thinners make your blood less likely to clot, which can lead to more bleeding if you get a puncture. However, this doesn't necessarily mean you can't have acupuncture. Many acupuncturists and medical professionals agree that acupuncture can be safe for people on blood thinners, as long as certain precautions are taken. For instance, the puncture needs to be located carefully and have the appropriate depth to minimize the risk of bleeding. Before undergoing acupuncture, it's crucial to consult with your acupuncturist and inform them about your medication. They will need to know your medical history and the specific blood thinners you're taking. This way, they can take the necessary precautions to ensure your safety during the treatment. In some cases, your acupuncturist might suggest avoiding certain types of acupuncture, such as electroacupuncture, if you have a heart pacemaker or other electrical devices. This is to prevent any potential interference with these devices. While the risk of severe bleeding is low, it's still important to be aware of it. Studies have shown that the incidence of minor bleeding is about 8.31 per 10,000 acupuncture sessions, and severe bleeding is about 4.26 per 100,000 needles. These are relatively low risks, but it's always better to be informed. In summary, if you're on blood thinners, you can still have acupuncture, but it's essential to consult with a well-trained and experienced acupuncturist first. They will help you navigate the process safely and ensure that the treatment is tailored to your specific needs and health conditions. So, don't hesitate to reach out and discuss your options. It's always better to be safe than sorry.